here we have our most vulnerable population, pregnant women and babies, and we've developed a system that's close to impossible to navigate. And the health of babies, the health of pregnant women is a sentinel indicator of the health of your community.
Healthy Start is concerned, the statistics are, that these babies don't make it to 1 year. If these moms are overwhelmed and have no food and have no place to stay, what's the chances of a newborn making it?
It was the first time I ever seen a doctor besides Karen.
And how many weeks were you?
34 weeks.
Well, black infant mortality is like many other health disparities that we see in race. And we need to determine why the disparities exist.
But it's something you don't bog yourself down with, because if you bog yourself down with it, then you can't move on. And she, like we were talking last night, she's found a way to cope with it. And she's coping very well. I'm coping with it. Now, you didn't ask what the saddest part of it was the day I went to pick out the dress to put on this child to be buried in. I broke down in the middle of the store with nobody around me. And somebody had just called me. I had to call somebody to come and get me out of that store.
When we first started looking at this data, we set a goal for 6 out of 1,000, which is the same goal we had for white infant mortality. If we thought it was an insurmountable problem, we never would have set that goal. In the last 2 years, we've taken it from 13 per 1,000 live births to 11 per 1,000 live births, and I believe that with some of the initiatives that we're focusing on, we can get it down even further.
In fact, that's the same thing that happened with Melanie. I saw her a couple times, but since she had twins, she was very anemic. That was, she really needed to transfer to an OB that can handle those kind of high-risk situations.
Can you describe what it was like waiting 34 weeks to see a doctor? How did that make you feel?
It made me feel kind of bad because I didn't know what was going on with my kids. And, I was really worried because I'm used to going to see a doctor time when I get pregnant. But it was hard because I was feeling sick all the time. And then I didn't too much know. The only way I found out everything was going good with them was when I went to the hospital.
So just to have somebody to listen to what's going on and really get the whole picture. And when I got the whole picture, I was able to call Healthy Start and say, listen, this needs to be her Medicaid. She was in an HMO. No one took that HMO in Volusia County. So Healthy Start called Tallahassee and got it switched right away. But it wasn't until I listed the twins, the anemia, her age, how many children she has, even her family situation, that her mom can only do so much, and her dad's disability, all those things rolled into one, really tugs on people's hearts to say, we got to do something for this young woman. And
we have a problem with access to care that starts with Medicaid, and since over 50% of our births are to women who are Medicaid eligible, it's incumbent upon us to figure out why we have these barriers and how to fix them.
I think we're 23rd or 24th in the world for infant and maternal mortality. And Australia was right up there with us. And they decided to pay women to go to prenatal visits. And I believe they're 7th now. So it just goes to show you how much prenatal care can affect the outcome.
The solution comes with changing the system around, letting the physician be the first point of entry to get a pregnancy test early in a pregnancy. Let the woman go to the hospital of choice, whichever hospital she's going to deliver at, and that her doctor delivers at. submit her paperwork to the hospital, get a card that says she started the process, go back to her physician now with her card that shows the physician that the hospital will now handle all the billing, and continue with her prenatal visits at her doctor, and then deliver at her hospital. And that's a very simple model.
Because twins is a chance that one may die, one may live, and I really wanted to know like what was really going on. But now that I know that they okay, I'm doing all right. I'm doing much better.